So, here you can see the diagrammatic presentation. So on the skin layer, suppose any parts of the body parts, on skin layer you are injecting the anesthetic drugs. So basically they are using for minor surgery or during hemorrhoids or minor burns or any diagnostic purpose. Sometimes you are giving some injections, painful injections. In that time also they are using some anesthetics. So these are general uses of your local anesthetics. Okay, local represents only the particular part or area of the body will be losing the sensation by using this type of anesthetics or local anesthetics. Okay. So, so we have to discuss about local anesthetics in details. So these are the general things you can check out. So these are the common uses of local anesthetics. So for excision means some minor cut or any burn is there, you can go for surgery. Okay, in that case you can use your local anesthetics. For dermatology, any skin related disorders on the body parts, you can go for this type of use of drugs. Or in dental surgery, dentistry using this type of local anesthetics. Or in case of spinal anesthesia, that is also on particular part it will be anesthetized. Okay, so these are the general uses or common uses of your local anesthetics. Okay, if we go for definitions, so local anesthetics are the drugs which on topical application you are giving only on topical routes or local injection can cause reversible loss of sensory perceptions. Means you are feeling only the loss of sensation. Okay, loss of sensation reversibly. It should be recovered. If it is irreversible, it cannot coming to the your original conditions. Sometimes due to high dose of anesthetics, people are going to coma stage. After coma, there will be final death or death will be coming after coma stage. So sometimes due to the anesthetic doctor's miscalculation or dose calculation is if it is not proper, then people may die. So to carefully the dose calculation should be carried out during your anesthesia process. Okay, so there should be reversible loss. Means your sensation can come into the normal stage after your surgery or after your any topical treatment of this anesthetics. So it is especially of pain, means sense means pain. You will feel pain, but the pain will be lost due to this anesthesia in a localized area of the body. So on particular part of the body, it will be applied. Okay. Block generation and conduction. How they are producing their action? By blocking the generation and conduction of nerve impulse at a localized site of contact without structural damage to the neurons. So your body parts are having neurons. That's why you are getting sensation. So how they are getting sensation? Through the generation and conduction of nerve impulse. So every time you have impulse through the nerve systems. So that time you are blocking the generation and conduction of nerve impulse with the help of local anesthetics, and it should be reversible. Okay, so that particular area, the nerve impulse will be blocked. Okay, by the use of this drugs. That's why you are not feeling any pain. Okay, after recovery of this stage, you are feeling again automatic small low level of pains. Okay, clinically to block pain sensation from or sympathetic vasoconstrictor impulse to a specific area of the body. Okay. So on particular area, you will not feel any pain, or there will be loss of sensation as well as motor impulse. So these are the impulse through the nervous systems. Okay. Some other type of agents are there. These agents are used to produce anesthesia or to abolish pain or decrease the pain sensation in restricted area in the body. So in particular area of the body, the sensation or pain will be reduced. Okay. If we go for mechanism of action, they are mainly producing the action on cell membrane. It prevents the conduction by blocking the sodium ion channel. So they are mainly acting on sodium channel so that the nerve impulse will be reduced, or generation and conduction of nerve impulse will be reduced. So by blocking this, how it is blocking? The blocking is achieved either by the drug is causing physical block in the channel, like a cork in bottle. Suppose your bottle is having cork, there will be no flow of water outside. Same thing. So it is just like act as a cork to block the channels, like sodium channels. The drug molecule distort the channels, so channel will be blocked by the drug molecules, increasing the surface pressure of the cell membrane. So surface pressure will be again increased. Okay. So main thing is it is blocking the channels like your sodium channel. And if sodium channel is blocked, again remaining channel will be open like calcium channel or potassium channel. If they are present, they will cause the loss of sensations. If we go for local anesthetics and general anesthetics, what is the difference between them? Okay. In case of general anesthetics, this is the different differentiation between local and general. Suppose you will go for site of action, they are mainly acting on central nervous system. If they are acting on central nervous system, total body will be again losing the sensation. But it is only for local, that is peripheral nerves on the particular part of the body that will be blocked or that will be losing the sensation. So it is specific for particular part, but it is specific, not specific. It is only for total whole body. That's why it is written area. Whole body will be losing the sensation. Here only restricted area. Consciousness. So it is lost. Total you will lose the consciousness. But sometimes it may be unaltered. Sometimes you will feel pain, or sometimes you can know what is going on. Okay, during surgery. Preferential use only major surgery. Here minor surgery. So minor cases it is useful. Okay. Then preferential use, major, minor. Use in non-cooperative patients. It is possible. Suppose some patients are very serious conditions. So you have to give general surgery because you cannot control the patient. It is non-cooperative patient. But here not possible. In non-cooperative patient, local surgery not possible because you cannot control him. So that's why you have to give anesthesia for whole body system. So for uncontrolled or non-cooperative patients, you have to use general anesthesia. Okay. Poor health patients, it is very risky. If patient is not good health, you have to refer local, that is safe. Care for vital functions, it is essential because you are giving whole body to be anesthetized. That's why you have to care the vital functions of other organs like heart, kidney. So you have to monitor all these things during your local general anesthesia. So it is essential. But in local surgery, it is not required. Only the particular part is anesthetized. That's why no need to control the heart or liver or kidney functions. Okay. But in general case, you have to maintain. So these are the general things which can be differentiated between local and general. Okay. So if we go for history, how the anesthesia or anesthetic drugs are coming to the market, or how it is used clinically. So in Western Europe, they have discovered or designed during this period the anesthetic drugs. Chemists and physicians collected sample of coca leaves for experiments. So from coca they have discovered or designed cocaine. That is a local anesthetic. Okay, the isolated active principle of coca leaf synthesized to a drug for patient to feel more relief of pain when taking the surgery. Okay, so they extracted from coca leaves. In 1860, German chemist name is Albert Niemann successfully isolated the active principle of coca and named as the cocaine. So you see, before so many years back they have discovered, but nowadays no discovery is there. You people can do the discovery. You can go for new research. Okay. So in current pandemic situation, you can discover some new things. So you concentrate on particular area of research, then only you can get the new drugs or new drug molecules. Okay. So what is cocaine? It is a ester of benzoic acid. So they have isolated cocaine and identified that it is a ester of benzoic acid, or otherwise called methyl ecognyne. Okay. So it is a benzoic acid ester derivatives, cocaine. So it is a first anesthesia drug discovered by the scientist Albert Niemann. Okay. So it is the same thing is given here. It is a local anesthetic agent isolated by Niemann in 1860 from the leaves of coca tree. It was demonstrated by Carl Kohler in 1884. After so many years, again they have found that it is an anesthetic drug and demonstrated by the scientist. How they discovered another drug? due to some network error. Okay, now it is visible.
Yes, sir.
Okay, so they have again designed some another drug, that is lidocaine. Lidocaine again in 1948 during your independence time. They have discovered or designed some another drug that is synthetic form of your cocaine. They modified the structure and designed lidocaine. Okay. The discovery of its anesthetic property was followed by in 1949 by the clinical use by T. Gott. So how the research is going on, you see from this figure. So it is not a single job or single day job. You have to go through the research one by one. Yearly it is taking so many times, or you have to go for clinical trials. So many steps are involved in your drug discovery process. So you have to go smoothly with your patients so that you can get some new drug molecules. Okay. So thereafter, series of potent anesthetic soon followed with wide spectrum of clinical properties. So again, new drugs are developed with wide spectrum. Means for different type of disorders, they have designed. Okay, so these are history how the drugs or anesthetic drugs are designed. So what should be the properties of local anesthetics? So they should have these following properties, otherwise they cannot be administered. So first one is it should not be irritating to the tissue to which it is applied. Suppose you are applying to the skin, it should not irritate to the skin. Suppose you are applying for dental surgery, it should not cause any irritation. Okay, so it should not have any irritation properties. Next is it should not cause any permanent alteration of nerve structure. So without any physical damage or physical alteration of nerve system, it should be used. So it should not cause any harm to the nerve systems. Okay, it should be only used for anesthetic purpose. Its systemic toxicity should be low. Its systemic toxicity should be low. So toxic level should be low. Otherwise, it may cause some other adverse effects. The time of anesthesia should be short. So within very short period of time, it should produce the action or anesthesis. Otherwise, you cannot go for surgery. So immediate within short period of time, it should produce its action. It should be effective regardless whether it is injected into the tissue or applied local to the mucous membrane. So it should not think we should not think that it is applied to the tissue system or mucous membrane. It should be effective without considering any type of this local system or your mucous membrane. Okay. The duration of action should be long enough to permit the completion of procedure. Procedure means your surgery. Suppose surgery is going on, it should continue the effect for long period. Otherwise, during surgery, if it is not working for long period, then you can feel pain immediately. So difficult to manage the surgery. So the duration of action should be long enough so that you can manage the surgery process. Okay. So these are some of the desirable properties. In addition to these qualities, Bennett's list other desirable property of the local anesthetics. So another scientist, he discovered or he designed some other properties. What are the properties? It should have potency sufficient to give complete anesthesia without the use of harmful concentration solution. He is telling that it should have sufficient potency. It should be potential at low concentration. You should not use some higher concentration. That is harmful concentration. In low concentration of the drug, it should have more potency. Okay. It should be free from producing allergic reactions. Already told you. It should not cause any allergy or irritations on the skin parts or any parts of the body where it is injected. So it should be free of allergic reactions. Okay. It should be stable in solution and relatively undergo biotransformation in the body. So whenever you are preparing the solution of this drug in any solvent system, so it should be stable. Otherwise, if it is degraded, you cannot administer properly. So your drug should be stable in the particular solvent or solution form to administer the drug. Okay, it should undergo biotransformation properly inside the body. If it is metabolized, there is no toxicity. If again it is difficult for metabolism or biotransformation, so there will be again toxicity. So it will cause again other side effects. So it should be stable in solution form and it should undergo biotransformation inside the body systems. Next, it should be either sterile or capable of being sterilized by heat without any deterioration. So whatever the anesthetic drugs are available, they should be sterilized because you are injecting directly on the mucous membrane. Otherwise, it will cause again any side effects or any allergic reactions. So it should be sterile. Otherwise, if you are going for sterilization by heat sterilization, suppose, it should not deteriorate or degrade the drug. It should be stable. It should not cause any deterioration of your components or drugs. Okay. So these are the other general properties of your local anesthetics. So if it is having proper properties, then you can accept for your drug. Suppose you will go for local anesthetics. What are the chemistry part? So there are two types of you have local anesthetics. One, some are amide derivatives, some are ester derivatives. So these are the common aromatic part on one side and some part. So this aromatic part already told you these are always having lipophilic property. Always the lipophilic property are depend on the your phenyl nucleus or aromatic part, and you have some drugs are ester derivatives like COR, some are NHCO. CONH means amide. So the intermediate chain is amide or ester. One side is common, that is aromatic. Another side is amine part. You see, these are the common structure for your local anesthetic. So these are hydrophilic. Okay, these are hydrophilic and these are hydrophobic or lipophilic. You check clearly. And this intermediate part is called ester linkage or amide linkage. Ester linkage means COR. RCOR is called ester. CONH is called amide. Okay. Next, we will go for classifications. Already told you there are two types of derivatives. One is ester type, another is amide type. Ester means RCOR dash. Amide means RCONH2. Amide. Okay. So again, there are different types based on your duration of actions. Some are long acting, intermediate acting, short acting. So if amide derivatives, if you will see, you have long acting like B.Pharm, B.Pharm, propivakine, divakine. So these are generally available under long acting. Then intermediate means lignocaine, otherwise called lidocaine, same, mepivakine, prilocaine, artikine. How they have got this type of drugs? By modifying the structure or any functional groups or any derivatives like amide or ester. So depending on the linkage also they are having different type of compounds. Again under ester type you have long acting. Example is tetrakine, otherwise called amethokine. Then intermediate acting called cocaine. Cocaine is a intermediate acting. Okay, next is short acting. Under that procaine, chloroprocaine, benzocaine, and proparacaine. So these are some of the drugs, amide and ester type. Some miscellaneous also available like pramoxine, dicyclonine, and oxythazine. Okay, so these are recently available drugs, newly available drugs. Suppose if you go for the site of injections like injectable or surface type, there are again two types. Route of administrations, based on route of administration, some are injectable with low potency and short duration. So in your GPAT exam or in your BPD exam also multiple choice questions are coming. The anesthesia with low potency, short duration and injectable type. You have an example is procaine and chloroprocaine. Procaine and chloroprocaine. Again, if you go for intermediate potency and intermediate and duration of action based on duration, suppose short acting or long acting or intermediate with uh, long duration, but it is intermediate potency, both intermediate duration and intermediate potency, both are there. So you have lidocaine and prilocaine. Suppose high potency, long duration, high potency and long duration, these are most required now. So tetracaine, bupivacaine, ropivacaine, divacaine. This is otherwise called syncocaine. So you should know the other name of these drugs. Like tetracaine, otherwise called amethocaine. Lignocaine is otherwise called lidocaine. Okay. Then surface anesthesia means they are applied on the surface of skin. So these are again two types: soluble type of drugs, insoluble type of drugs. Soluble are cocaine, lidocaine, tetracaine, and binoxinate. Okay. Insoluble means benzocaine and butamben, oxytazine. Okay. So these are some of the drugs you remember. So based on this, you can get some questions, MCQ questions. Okay. So based on mode of actions or applications, topical type or injectable type, something already told you. So if again topical, what is a soluble form or insoluble form? If it is soluble form, then you have cocaine, lidocaine, tetracaine and benoxinate. If it is insoluble form, you have benzocaine, butyl amino benzoate, insoluble type of topical anesthesia. If it is injectable, you have lidocaine, mepivacaine, tetracaine, B.Pharm and dibucaine. So these are the different types of classifications. Based on duration of actions, so how much time they are giving the action, based on that time period is given with examples. What is ultra short acting means within very short period of time they are giving the actions. Ultra short you will have procaine and chloroprocaine. Very short period of time they are giving the activity. Your short duration of action. You have lidocaine and prilocaine. Medium or intermediate type. It is mepivacaine and atrikaine. For long duration of action, you have bupivacaine and etidocaine. So based on the type. So for soft tissue means these are the site of your injections or administrations. Okay. So for tissue and mucous membrane, what is the difference time? They are mentioned here. Okay. Based on that, you can classify the drugs. Based on potency, low potency, intermediate, and high. Under low potency, you have procaine, chloroprocaine. On intermediate type, you have lidocaine and mepivacaine under intermediate. Under high potency, you have tetracaine, pipivacaine, and diabucaine. So remember, based on potency, based on duration of action, based on site of actions, or based of site of or route of administration. So like that you have to remember for exams. Suppose you will go for local structure activity study of local anesthetics. So this is a general structure activity as per your syllabus. It is given. This is a general presentation of your SR studies. So how they are producing their actions. I told you on the left side you have lipophilic structures. Lipophilic part is there, means that phenol nucleus is present. Okay, on intermediate or middle part you have ester linkage or amide linkage. Okay, and your right side part is hydrophilic. Amine group is there. Okay, so amine means you have secondary or tertiary amine, or you may have cyclic structure or non-cyclic structure, like your pyridine, pyrimidine. These are cyclic structures. Okay, and some bridge may be there. So this bridge may contain carbon chain or oxygen or nitrogen or sulfur. Okay. So this is the general things. How they are affecting the activity we can discuss on your individual drugs. Okay. So mainly this hydrophilic part and hydrophobic part. This is hydrophobic part or lipophilic. This is hydrophilic. So hydrophilic is mainly responsible for your solubility of the drug. Okay. And these are responsible for crossing the cell membrane. Okay. So like this, and these are responsible for your bioavailability of the drug and binding of drug with receptors. So these are all these things we can discuss on individual drugs. Okay. Next we will go for first drug is benzoic acid derivatives. Okay. Benzoic acid derivatives. So under that you have cocaine. Benzoic acid, you know benzoic acid. Benzene with COH. Benzoic acid derivative. So it is a ester type. Okay, cocaine is also known as coke. It is a strong stimulant, most frequently used as a recreational drug. Recreation means already it is there in the coca, means that coca plants, but it is designed, recreated as a drug. That's why it is called a recreational drug. Means they have designed this drug for the treatment of particular disease or particular use, that is anesthesia. Okay, it is commonly snorted, inhaled as smoke or dissolved and injected into the vein. So for anesthetic purpose, you can use any term. You can use as a smoke or you can dissolve in the solvent to use solution, or they may be injected into the vein sometimes. So how they are acting? They are acting by inhibiting the reuptake of serotonin, norepinephrine, and dopamine. These are called as neurotransmitters. Okay, they are inhibiting the reuptake, so that neurotransmission will be inhibited. If there is neurotransmission is inhibited, there is no impulse. There will be no nerve impulse. If nerve impulse is not there, sensation will be not there. So there will be loss of sensation. Okay, understood? So they are producing the action by inhibiting the reuptake of serotonin, norepinephrine or noradrenaline and dopamine. So these are the neurotransmitters. Their reuptake is inhibited so that there is no nerve impulse. If nerve impulse is not there, there is no sensation. Okay. They can easily cross blood-brain barrier and may lead to the breakdown of barrier. So because of your lipophilic property, they can cross the blood-brain barrier and produce the action easily. Okay. Cocaine is now predominantly used for nasal and lacrimal duct surgery. So now particularly they are useful for nasal. In the nasal part, any problem is there, they can go for surgery by using this as a anesthesia, or lacrimal duct surgery in your eye, ophthalmic surgery. In the lacrimal area, if any problem is there, they can go for surgery by using these anesthetic drugs. Okay. Cocaine is a powerful nerve stimulant. So it is a nerve stimulant, cocaine. Okay, the duration of cocaine effect depends on the amount taken and the route of administration. So if you go for duration of action of cocaine, it mainly depends on the how much amount, how much concentration you have used, depending on the concentration and route of administration, whether it is on your topical route or it is injected through vein. So based on that, it produces the actions. Okay. The first synthesis and elucidation of cocaine molecule was given by Richard Wilster in 1898. Okay, the first synthesis and structure elucidation. The structure of this molecule was confirmed by the scientist in 1898. Okay, so this is your cocaine. Okay, if you go for nomenclature, so it is a ester form. Here it is your phenyl liquorous, that is the lipophilic part. R C O O R C O O R. Remaining is R dash. Suppose this part is R dash. This is R C O O R dash. So R dash is your, this is side chain. R is your phenyl nucleus. This phenyl nucleus is your hydrophobic or lipophilic part. This is your ester linkage, and this part is your amine group or amine linkage, amine, like this. So this type same ester linkage. This part is your aromatic part, and this part is amino group. Okay, like this. Same thing it is given, but position wise it is opposite side. This side is given. So this is your phenyl group responsible for lipophilic or hydrophobic property. This is your ester linkage. This is your amino group or hydrophilic part, responsible for solubility of the drug. Okay, if you go for your IPS name, so here you can see octane 2 carboxylate, octane 2 carboxylate. Okay, octane 2 carboxylate 8 aza bicyclo. Suppose this is aza, nitrogen represents aza. Okay, 8 aza bicyclo. Then 8 methyl. This is 8 methyl. So 8 position you have methyl group with aza bicyclo. This is 2 cycles attached here. 2 cycle is there. This type and this type here. 2 aza bicyclooctane 2 carboxylate benzoyl oxy. Benzoyl. If phenyl with CO is there, it is called benzoyl. If it is CH2 only here, benzyl. Phenyl nucleus with CH3 or CH2 here, it is benzyl. If C double bond O is there, it is benzoyl. So benzoyl oxy. Okay, and this part is methyl again here, this methyl. So inside they have considered octane 1 2 3 4 like this, 8 is there. Okay, octane 2 carboxylate, this part, octane 2 carboxylate aza bicyclo 8 methyl, here benzoyl oxy, then methyl, this part. So like that they have given this presentation. So these things, remaining part we'll discuss. Your some SR studies already told you. Some more discussion I'll carry out on next class. So from this, any doubts we can clarify. So slowly we'll complete your syllabus, but during your class you can ask any doubts if you have. So these are mainly used for your minor surgery, because on specific part you can use this type of local anesthetics. Okay, on localized area they can be applied. So mainly it is producing the action by blocking the channels or by blocking the generation and conduction of your nerve impulse. How they are blocking? By blocking the channels, your sodium channels. Okay, without damaging the neurons, without damaging of your neuronal systems. Okay, you have different neurotransmitters like serotonin, norepinephrine, and dopamine. So they are causing the nerve impulse. If they are inhibited, then your impulse will be, generation of impulse will be inhibited, and there will be loss of sensation. So these are the difference you can see, and how they are discovered this cocaine or local anesthetics one by one. All these things are covered. You can read from these slides. I'll send you today. So any doubts you can clarify from this. So these are the general properties of your local anesthetics. So it should have this type of properties to produce its suitable activity. Okay. And these are the general features of this local anesthetics. All local anesthetics have this type of general structures because they are ester type and amide types. And this one part is a hydrophilic or lipophilic part. This is hydrophilic part, this is lipophilic, this is ester amide part. And based on the duration of actions, they are categorized. And based on your potency, there are also different types. Based on solubility, based on your route of administrations, you remember all these things. Okay. So from this, you can ask any questions. Then next class, we'll discuss remaining other drugs. So in between, you can cover your syllabus. You read thoroughly, and any doubts, you can ask anytime. So these are the general essay study of your anesthetic drugs. So all are present in your anesthetic drugs, how they are responsible for their activities. They may be responsible for solubility, they may be responsible for lipophilicity. If it is lipophilic, they can cross easily the blood-brain barrier or cell membranes. If it is ester form or amide form, they can be break down easily and go for biotransformation or metabolism because they are all easily hydrolyzed. This bond can be easily hydrolyzed or break down by the hydrolytic process. And this bridge is mainly responsible for your drug binding of drug with receptor. This is responsible for solubility. So every drugs they should have common structural features. They should have lipophilic center. They should have hydrophilic center. They should have some bridge or side chain which are responsible for binding of drug with receptor. Then only they can produce the action. Otherwise, there is no use. They will cause some toxicity. So before designing any drug molecules, you should follow these principles. One rule is there that is called Lipinski rule of five. They should follow the Lipinski rule of five. In drug designing, I can tell you that time how they are following the Lipinski rule of five. So they should have that five rules. Then only that drug is considered as an active drug. Okay. So these are common features of your co-kinds. Okay. So next class we'll discuss remaining part. All of you give your attendance or any doubts you can ask me now. Any doubts? We are preparing for your medicinal first sessional exam. So we'll send you the information. So within 3-4 days we'll complete that one. Don't worry for that exam. So previous exam network error was there. So I'll make ready that one and we will finish that exam. Okay, any doubts? We'll conclude the session. Today I'll send you the remaining materials and this material also. You read thoroughly. Don't waste your time. Okay.